They've called for a medical consult, and Dr. Mike is here to react and comment on the declining health of the American conservative media mogul, Logan Roy, from the show Succession. Let's get started and take it right from the first episode of the first season. Whoop. So nighttime awakenings for elderly men are one of the biggest risk factors for an early death because of hip fractures. In the middle of the night, when it's dark, you're a little woozy, you don't know what's going on, a fall can happen, a hip fracture can happen, and immobility for someone of elderly age can be very problematic. When you're immobile, you actually have higher rates of blood clots, heart disease, and those things happening in that moment as opposed to 10 years down the line. Here he's exhibiting a little bit of confusion. For me as a medical provider, I start thinking of something known as AMS, altered mental status. This can happen in elderly individuals as a result of a urinary tract infection, really any infection.
Logan. Oh. Where am I?
Yeah, getting old is tough. But after that, that warrants a 911 call because you don't know if that AMS is due to a urinary tract infection, he had urinary urgency and frequency and he went, or is it because he's actively having a stroke? Hard to know.
We get that, we do, and we would love to help.
Mm-hmm.
I mean, I would love to help.
And help?
But I mean, why would I? When I'm giving away power, why would I do that?
So Kelly,
Who's Kelly?
Kelly must have some figures. You should see that, every
Dad?
day.
So here we're seeing signs of slurring of speech,
Dad.
inability to find words, full-on syncope, like he could be having a heart attack right now. The first thing I'd be doing in a situation like this is checking for a pulse, because if he's unconscious without a pulse, you gotta start chest compressions.
It's really hot. Open strap.
Well, he is somewhat conscious, so there is no need for chest compressions at this time. Protecting his airway is of utmost importance, so making sure that if he does vomit, because a lot of times people will develop nausea in situations like this, making sure that they don't aspirate or choke on their own vomit.
What is this part of the hospital? I mean, is this the best section?
A lot of patients ask questions like this. Is this the best? Are you the best doctor? That doesn't really exist. Yes, you want private rooms, you want to make sure that the attendings are there, but the protocols that the hospitals have in place are already the best. Doesn't mean advocacy by family is not important. That's actually very important.
The ICU is the ICU. This is the best place for him.
Is this where you would take your father?
Sorry, can the team have some space, please?
Hey, here's an idea. Why don't you worry about the medicine, not the feng shui?
Energy. Let's let the gentleman do his job.
Thank you.
It's not the feng shui, it's about the fact that doctors, nursing staff can't adequately perform their jobs when they're distracted by family members. So yes, the medication error rate goes up when the family's in the room putting pressure on the medical staff.
Take me through what happened exactly.
I don't know exactly. It was weird. It happened fast. We were just sitting
talking.
there and we're talking. She kind of started hardballing Dad.
Wasn't
a little
hardballing
bit,
him.
And then, okay.
Brain hemorrhage doesn't come from some chit chat.
They're saying brain hemorrhage, which means a brain bleed. Remember, when there's strokes, there's two types of strokes. A hemorrhagic stroke, where there's some kind of blood vessel rupture in the brain and you have bleeding into the brain so that you're not getting enough circulation. But then also you could have a stroke from an ischemic component, which means that there's a blockage of blood flow, like the plumbing is blocked and you're not getting enough circulation.
Somebody said that, right? Somebody said hemorrhage?
Or stroke?
Hemorrhage is a stroke.
It could be an aneurysm.
An aneurysm can be a risk factor for a stroke, especially if it ruptures. A ruptured aneurysm can create a hemorrhagic stroke. So they're saying a lot of medical words, but they're not putting them into context. Getting a CAT scan here.
He's had a hemorrhagic stroke, a bleed in the deep right hemisphere that put pressure on the thalamus and the brainstem, and that's what caused the loss of consciousness.
So apparently some blood vessel had ruptured. There was bleeding inside the brain, which could be visualized on a CAT scan. And from there, you have to just work on stabilizing the patient. Sometimes the hemorrhage can be so bad that you actually need to perform a craniotomy, where you take a piece of the skull off of the person and you allow the pressure to escape. If you're increasing pressure from bleeding into an enclosed space, you could actually create like pressure and a mass effect that is lethal.
The evidence is that operating in situations like these isn't worthwhile.
A lot of times the bleeds or blockages happen in deeper areas of the brain. So they're sort of inoperable because the amount of risk you have going into the brain in order to reach this can actually outweigh the potential benefit of stopping the bleed, especially if the bleed is already stabilized on its own. There are certain ways that they do this through less invasive methods where they go actually through arteries and can actually go through, let's say, your radial artery. It's actually the way we put stents into the heart when someone is having a heart attack, but this is not available for all types of blockages.
Well, we will carry out regular observations and hopefully we'll see some improvement soon.
Well, thank you for your input, but you'll understand if we check out our options. My assistant's been in touch with Ann Wyman at NYU, and we might move Dad there.
No, he stays here. He gets better here.
Moving patients when they are in a critical or near critical condition is usually never advisable because a lot of things can go wrong during the transport. And when that happens, you have way worse outcomes. Even when we have a patient that I am, let's say, wanting to bring from the regular hospital floor and I want to bring them to the ICU for more careful monitoring, I cannot move them until I have created a level of stability in their own room. And that's just moving within the hospital. Think about flying them, et cetera, et cetera.
We'll discuss and get back to you.
No discussion. I am his next of kin. I am his proxy.
A lot of these situations occur in hospitals where next of kin arguments occur, and I've seen really messed up situations. Like this is probably one of them, but I've seen ones where you have children taking advantage of an elderly family member because they're cashing their like social security checks, or they know that if this person is to pass, they would lose some sort of benefit. Financial elder abuse is real, and a lot of times it gets exposed during situations like this.
I need a piss.
Oh.
Shiv.
Sure. Do you need some help, or I can reach out to...
You. Let's go.
You want to make a decision now, before, or...
Uh-huh.
What you think, Logan? Yes or no?
I see altered mental status coming back.
Hey, are you okay? You're really shivering. I think we need to get you seen by somebody. I think...
Thanks, son.
Anytime. Pop.
I mean, it's full-on altered mental status in situations like this.
Shiv, your dad is totally out of it.
There's no way you can say that someone is competent enough to make a business decision, especially that affects so many people. And I think as a publicly traded company, you have to disclose this. There are rules set forth by the SEC.
Hey.
Hey, Carrie, is Dad on any medication?
He has a UTI. Why? Is he all right?
Could his meds make him confused?
Shouldn't. That's what happens if he doesn't take them.
Anytime an elderly patient has an infection, they can become altered mental status. They can develop an altered mental status because when there is a requirement for higher blood flow to the infected area, there are stress hormones released. That essentially creates a level of confusion because there's not enough circulation or blood pressure to even reach the brain.
Tom, what's going on? What happened?
So he was short of breath and he went into the bathroom. And
he was gone, and what was someone heard something, and he was. We were concerned.
Yeah, they had the key and they got in there, but he's not responsive.
Is he still in there? Or he's non-responsive?
Non-responsive on an airplane is a serious cause for concern.
They're doing chest compressions.
At least they're doing chest compressions.
Has his heart stopped?
I don't know.
Do you have the machine on board, the heart thing?
The AED should be on board, given the fact that it's such an expensive plane and all. But the first thing they should be doing is rerouting the plane. Next, they should be checking for a pulse. If he's truly unconscious without a pulse, they should be doing chest compressions, and someone should be getting the AED.
Okay, I'm putting you by his ear now.
Oh my God, those are some terrible chest compressions.
Tom, is he okay?
No, Rome, he's not okay.
But you can speak into his ear right now.
Do not speak into his ear. Hang up this phone call and focus on trying to revive their father. Okay, those are really bad chest compressions. Remember, the purpose of doing chest compressions is to physically move the chest down 2 inches, to squeeze the heart, and therefore take the blood that's within the heart and push it throughout the body, almost like simulating a heartbeat. But when you do that, you're only getting about a 20% efficacy if you do it perfectly. When you do it like that, it's complete poop.
I'm heading to the back of the plane and
Oh, I hear the defibrillators. That means they have put on the AED. The way the AED works is you can put it on while you're performing chest compressions, and then it'll say,
Don't touch person. Analyzing.
It'll tell you if this is a shockable rhythm.
Shock advised. Press flashing shock button.
It'll say charge.
Shock delivered.
Start CPR.
If it's a non-shockable rhythm, he'll say, non-shockable rhythm, immediately continue doing chest compressions.
I mean, they say his heart has stopped and his breathing has stopped. For a while, maybe.
For someone of his age, if you're going 20 minutes with a stopped heart, that is catastrophic.
But that doesn't mean that he's dead medically.
That means he's dead.
I need my doctor, and I need, do they have his doctor?
Do you have his doctor on the line?
There is no help that his doctor can give in a situation like this. This is a first aid, land as fast as possible to a hospital. If you have epinephrine, maybe you give it in a situation like this, but I can't imagine anyone on that flight is gonna be capable enough to do this. Here are things you should never do in the hospital, especially the way that the Roys did it. Click here to check that out, and as always, stay happy and healthy.